All right, welcome, 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 and thank you again for joining us for our recovery-friendly workplace initiative with our presenters, Samantha Lewandowski and Tyler Meenach. Today's presentation is brought to you by the Great Lakes ATTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTTC are funded by SAMHSA under the following cooperative agreements. The views expressed in this training are the views of the speaker and do not reflect the official position of DHHS or SAMHSA. The ATTC network uses affirming language to promote the promises of recovery by advancing evidence-based and culturally informed practices. We do have a few housekeeping items for you. If you have any technical issues, please individually message me, Alyssa Kuala, and there's a typo on this slide, so I'm so sorry about that, or Jen Winslow in the chat section, and we'll be happy to assist you. If you are in need of any captions or the live transcript would be helpful, please locate the caption option in your Zoom toolbar by selecting the More, Captions, and then Show Captions. If you do have any questions for the speakers, please use the chat and we will have some time at the end of the session today to answer those questions. Certificates of attendance will be sent out via email to all who attended the session in full. This may take up to 2 weeks. If you would like to stay connected with us, follow us on Facebook. We just created a LinkedIn account, so check out our LinkedIn page. We also have a YouTube page, and our Anchor is our podcast channel, so check us out. And I'm super excited and honored to hand this over to our presenters, Sam and Tyler. Sam, Tyler, thank you so much for being here.
Thank you so much for having us. So my name is Samantha Lewandowski, and I am the program director for New Hampshire's Recovery Friendly Workplace Initiative, which is administered by Granite United Way. I'm currently in a hotel room because I've been in Atlanta presenting at the RX Summit. So we just did a panel yesterday. So that's why my background is the way that it is.
Very good. And my name is Tyler Meenach. I work for Hamilton County Public Health, which is in Southwest Ohio. We are based in Cincinnati. So Cincinnati, the seat of Cincinnati is Hamilton County. And I am the kind of scalable local approach to the recovery friendly workplace. I'm a health coordinator within my division at Hamilton County Public Health. And I've been given graciously by Sam and others a lot of information about RFWs and how to replicate it. And that's why I'm here today.
Yeah, I think Tyler is a really great example of, we have a lot of other states reaching out to us who are interested in learning more about our model and how to replicate it and kind of best practices. And I think that Tyler and the pilot that's going on in Hamilton County is a really great example of what that looks like, because, a lot of times people reach out and they're kind of wondering, how do I do this? And I think it's so helpful, as we know, to be able to learn from peers who have gone through the process. So I think with that, we're ready to jump into my presentation. So I'll have about 30 minutes, and I'm going to be providing an overview of our model. I'm also going to talk a little bit more about the recovery from the workplace process, share a little bit about some examples of impact. And I'm actually really excited because we will have one of our recovery from the workplace employers be joining us today. He might already be on. His name is Mark Bonta. And then I'll talk a little bit about some of the lessons that we've learned and some of the national work that we do around this topic. So a little bit more about the Recovery from the Workplace Initiative. So it's interesting because I've been in Atlanta with a company called Forest Marsh that did a workplace survey of employees, which is kind of unique because we don't always get to hear from them. And they posed the question, are employees ready to be supportive of recovery in the workplace? And what their data showed was that overwhelmingly, yes, employees actually were ready. They were ready to talk about it. They were ready to be supportive of those who are impacted by behavioral health conditions. Not everybody, but the overwhelming majority were. And so I think at Recovery from the Workplace, we kind of pose the question, are workplaces ready to lead the charge? And do they understand all the benefits that go along with that? And depending on how they answer that question, that's where we can kind of step in and support them in creating that recovery friendly workplace culture. So The Recovery from the Workplace Initiative is an initiative of Governor Sununu. It was launched in March of 2018, and it was really informed by his experiences and time as a business owner himself. So he saw employees who were impacted. He owned a large ski resort. So people were impacted. And, initially at his company, they didn't really know how to approach or address or support people. And so he was like, we have to figure this out. So as they started getting pieces in place, they were also realizing like, it's really hard for people who come forward to get help. So with that, he kind of worked on some of the statewide systems that we have in place, in particular, 211 interfaces with a system in New Hampshire called the New Hampshire Doorway. And the doorway is helping people access treatment and navigate those options and just make it less overwhelming for people. So I kind of think of recovery from the workplace and the doorway system as two sides of a coin. They pair very nicely together. So with our initiative, we're trying to promote the health, safety, and wellness of New Hampshire workplaces and employees. And more specifically, obviously, we're focusing on the workplace and helping them become more supportive to impacted individuals. So that might include people who are in recovery, people who are not yet in recovery, as well as loved ones who are impacted due to having a loved one with a substance use disorder. A big part of this work involves challenging the stigma around SUD. And we know from the research that this kind of approach helps to encourage employee retention and productivity. A little bit more about how we are structured. So I am the program director, like I mentioned, and I'm also currently serving as our multi-state liaison. So providing information and assistance where we can to other states who are interested in learning more about the model. We are also overseen by an advisory council that's made up of business leaders, people from healthcare, people from recovery community organizations, and they provide high-level strategic guidance on the initiative. And then, like I mentioned, we are administered by Granite United Way in partnership with the state of New Hampshire. Ultimately, we report to the governor's office. I oversee a team of 4 fabulous recovery-friendly advisors. So the advisors are the ones who are working one-on-one with every workplace who signs up to participate with us and really helping them build their RFW culture. In terms of our workplaces, so we actually started with about 25 early adopter businesses. And since that time, we have grown to over 340 workplaces representing over 88,000 employees. I just pulled those updated numbers ahead of this presentation and the panel I was on yesterday, and I almost like fell over when I saw that. And that number is not including the state of New Hampshire. Well, it includes the state of New Hampshire as one workplace, but what we're doing with them is taking a department by department approach. So there's actually like 30 departments for the state of New Hampshire. And then in our model, we try to partner really closely with recovery community organizations and New Hampshire's public health networks. And also, like I said, those statewide systems around kind of coordinating access to treatment. And overall, we're really just trying to kind of wrap the workplaces in supports, break down silos, and convene resources in a collaborative way for a common purpose. And we've heard that kind of bang for the buck, what's been invested in this program has really paid out quite high in terms of ROI. So we're really proud to hear that. And I think that kind of breaking down those silos has contributed to that. Sometimes people are interested in our funding sources. So I just have a little bit of information about that. So our initial funding came from State Workforce Innovation Board, Governor's discretionary funds. We had $460,000 there, and that funded 3 recovery-friendly advisors and related program expenses. And along with that, we had a one-time $1 million appropriation from the Community Development Finance Authority. And that supported capacity building and ancillary supports. We were able to fund 5 additional nonprofits to kind of help us deepen the depth and breadth of our work. And it also funded a part-time director. We also had received a small amount of funds. Well, it's not small, but comparatively to some of the other ones, but we received $200,000 from the Department of Labor, a dislocated worker grant. And that went to do a capacity assessment of those nonprofits and some related TA. So they helped us build out some of our training modules. And then our current funding cycle has been coming from Governor's Commission funds. So for state fiscal years 2021 and 2022, we were receiving $450,000 a year. In state fiscal year 23, we've been receiving 400,000, and that's funded. It's really focused on staffing, and anyone who's heard me talk about the initiative before knows that I'll always talk about how critical it is to staff this. Sometimes people want to start with a toolkit, or I think they haven't really been able to think through like who's actually going to be serving the workplaces. So what we found in New Hampshire is having the advisors be able to build the relationships with the business has really contributed to the initiative's success. And then it also, includes some funding for related program expenses like professional development, travel, all that kind of thing. Sometimes we're also able to apply for and secure some additional federal funds. So in particular, CARES Act funding and ARPA funding. So this map shows what we've been able to disperse through Granite United Way and Recovery Friendly Workplace, specifically to different partners, nonprofit partners across the state. So that's been cool. And I think, partners' capacity to work with us can really vary. So anytime you can pull in some funding for them, that's going to help them be able to dedicate a little bit more time to working directly with you. And then a little bit more information on some of the ways in which we support our recovery-friendly workplaces. So we offer a structured but flexible approach. And what we do is we have a checklist process, which I'm going to go through. But within that checklist process, we really kind of customize it to meet the business where they're at. And we're really trying to move them along a continuum of culture change. So we know that like a large manufacturer is probably going to have different needs and maybe different questions than a small mom and pop shop that's just off of Main Street. We get people connected to statewide, local, and national resources. Sometimes, like I said, we're able to provide additional funding to partners and provide some additional coordination there to expand access to direct recovery supports. We have a large internal database of tools and materials that we're kind of pulling and curating for each workplace. We provide no-cost trainings to our workplaces. What we found is that is something that businesses were incredibly interested in. And we actually felt like when we did a scan of training content, we didn't find a lot that was like business ready. So we actually started off by creating 6 training modules, and it's just kind of grown from there. We can share policy resources and samples. And I'm really excited because within the past, I would say 6 months, we've been able to secure 2 sessions with an attorney actually, and she just did one for us this past week on return to work agreements, because sometimes we get those really like specific and technical questions. A lot of what we're doing at Recovery Friendly is kind of providing information on what is a recovery friendly approach, what's more recovery friendly, what's less recovery friendly. All of our staff are trained recovery coaches or higher. Some of them have a CRSW credential. I know that like peer supports credentials can vary depending on the state. So, but sometimes employers, they have these technical questions, and that's where we try to bring in subject matter experts. I would just encourage anyone who's doing this work to be confident in what it is that you offer, and don't be afraid if you feel like you're not able to cover something. It's probably just a sign you need to tap into another resource or create another offering. And along with that, we can facilitate connections to peers. So both in terms of the direct recovery supports, of course, that's included in our org chart, but also peers to other workplaces. So if let's use manufacturing again, if I'm in HR and manufacturing and I'm getting some really specific questions, how did you implement your return to work agreement, and so on and so forth, I may just want to talk to another person who's in HR and manufacturing, because they're going to understand my realm and my world better than a lot of others will be able to. We can also provide some support around creating an RFW committee or doing an RFW survey to get a little bit more data. We can provide connections to existing workforce development programs in the state. And we really provide, especially the staff, that ongoing kind of dialogue and structure and support around building a culture, which is a process that can take time and it can feel kind of amorphous. Some key accomplishments to date. So people were like laughing when I said this yesterday, but I'm like, I think we've demonstrated that it's been a successful pilot at least, and maybe then some. And now we're able to work on program refinement and really stabilization. And I mentioned the number of workplaces we have participating. On the right there, that's some of the logos of our participating recovery-friendly workplaces, which are located on our website. If you go to recoveryfromtheworkplace.com and click, I think it's like designated, that's where you can find that information. We've engaged people in RFW activities over 34,000 times. We've built out over 15 different trainings, and people have engaged in RFW trainings over 4,000 times. I've, between myself and our previous program director, we've connected to 30 other states who are interested in learning more about the model, many of which are interested in replicating our model, maybe with some tweaks if needed, spanning over 55 different entities, because sometimes I have several entities, different entities from the same state reaching out. We've been able to develop a bunch of additional marketing and informational assets, including 7 employee testimonials. And we're currently working towards an evidence-based certification through the New Hampshire Service to Science process. As part of that, we completed our first ever all RFW business survey that was last year in February, which has earned us a promising practice designation, which is part of the steps to then get to evidence-based. That would be the next thing we're working on. A little bit more about our process. So I'm probably not going to go into this too much, but I just wanted to provide some of the framing. I think people here probably are buying into why employers should do this, but this is some of the content that we might present on if we were doing like an employer presentation. So, letting employers know that this is an issue that's already at your workforce, because I think in some employers, especially if there's a little bit higher levels of stigma or a little bit lower levels of awareness about SUD or the prevalence, they can feel like by doing this, they're like inviting it into their workplace. And so what we try to highlight is it's actually statistically already in your workplace. It's just whether you want to be able to proactively address it and make it ideally a culture where people feel safe coming forward and disclosing, so you can really kind of support them and retain that talent or attract talent versus kind of having to deal with things retroactively or using a punitive approach where you lose people. So that's some of what we speak to with our employers. A little bit more about what our model is based off of. So it's really based off of this one-page checklist process. So the governor sat down with our former program director, and he was very passionate about the checklist being a page because he wanted it to be something that was meaningful, but actually doable with businesses. And I think that that's something that our model has kind of touched on that works, which is you have to work with the businesses and with the business experience. And then our program director brought quite a bit of experience in public health research around workplace wellness and prevention. And from that, our checklist was born. So there's 3 sections of components. So we have initial, additional, and optional. So when our workplaces start, they submit a letter of interest saying that they would like to participate in the initiative. That pings us to get them assigned to one of our 4 recovery-friendly advisors. The advisor then goes out and does an orientation, ideally with leadership and HR. We're trying to get that top-down buy-in. We know that that's really important. That stigma is challenged at that level. During the orientation, we can do, or at really any point, we can do a cultural assessment if they would like. And then we ask that they make a declaration to their employees saying, we're participating in RFW. This is what this means for us. We're committed to the principles. And then to kind of help raise the visibility and help with challenging that stigma, we get them an initial designation as a recovery-friendly workplace. And then the workplace has an additional year to complete those additional required components in order to maintain and then renew that designation for another year. So that looks like getting information and resources out to employees, getting connected to their local recovery community organization, doing an annual review of their substance-related policies. We certainly invite people to review their policies through a recovery-friendly lens and make updates if they would like. We just don't mandate that people create or change policy because, like I said, we found that it's really important to kind of work with the business experience. And I think when they feel like not pressured and maybe like it's not super like rigid and top down, I think it actually invites them to come forward and to pursue a little bit because they feel like they get to pick and choose what they want to do. So in our recovery friendly workplace survey that we did, we found that almost 40% of respondents which we had about a 25% response rate. So it's not like statistically representative of all of our workplaces necessarily, but we found that nearly 40% had made policy changes as a result of participating in RFW. So that was pretty cool to see. And some of those probably were smaller businesses that might not really have a strong policy component anyways. We ask that our workplaces do some kind of training around substance use and recovery during the course of a year. Like I said, we have over 15 we can offer. And then at the end of the year, we sit down with our workplaces and we do a designation renewal process where we kind of talk about what they did to meet each of these items. We set goals and there's a reflection section, and just kind of, we get the plan in place for the next year. And then that middle portion of the checklist repeats. And then in terms of the optional components, I know I talked about, forming an RFW committee, doing an RFW survey, getting involved in community-based activities and events, and really just coming up with creative implementation strategies. So we've seen employers bring recovery meetings on site. We've seen employers, the employer who will be on today and might be on already, will sometimes let his employees stay on the clock to attend a recovery meeting, because he says that he sees that as part of their job responsibilities, is to stay in recovery, because that's what they need to do to maintain their job and their health. And so it's kind of like stepping back and letting the business shine and being surprised by them, because I think that we have been surprised by them sometimes in terms of how above and beyond they'll go for their workforce. I don't have time to go into all of our trainings, but I did just want to kind of highlight our training menu, and you can email us and we can share our slides with you after the training today. Just to provide some examples of some of the education and resources we provide. So for example, we have a substance use disorder and stigma 101 training. And during that, part of that training is around language, which I know a lot of people here are probably passionate about. And then, like I said, providing information on 2-in-1, the Doorway, New Hampshire's recovery community organizations. Sometimes the recovery friendly advisor role is described as being like a concierge to the community. So some examples of impact. So Hypertherm is one of our champion employers. And sometimes I think people are like, well, what are people doing, or what does this look like in the workplace? And so Hypertherm came up with this great graphic that kind of shows when someone's impacted at their workplace, here's kind of the different pathways that someone could seek support. And just like recovery in any other context, we know that it's really important for people to have options and be able to pursue those different pathways, because people might feel comfortable with different things. So at Hypertherm, somebody could go to HR, they could go to a team leader, they could go to their EAP program, which is called Uliance. And what they actually did with their EAP program was they bumped up the number of sessions that somebody who is impacted by SUD can receive from them. And they also made sure that their EAP was connected to their local recovery resource, because they had not been before that. They also have trained, I think they're calling them recovery resource champions. So for a while they were trying some trained recovery coaches who were like peers, like fellow employees that other employees could go to. And now they're calling them a recovery resource champion. They do like a half-day training at Hypertherm. And really the point is to educate them on how to have a non-stigmatizing, non-judgmental conversation and direct that person to resources. So it's not about that person becoming like a recovery coach, but just being someone that someone could know is like, they would be a safe person to talk to. They also have SUD resources on their website, including on their public facing website, which is very cool. They do resource cards, which is cool because that's been an idea that a lot of our other RFWs have adopted. So just like a business card with different information on resources and challenging stigma. And then they also have an MLADAC who comes on site for a few hours each week and helps people kind of navigate options, can kind of like bridge to maybe when someone's able to get into a counselor. It's not meant to be like their ongoing MLADAC, but definitely helping people get a plan in place and bridge to support. This slide has links to some of our testimonials, and just wanted to kind of highlight some of the different stories we were starting to capture. And overall, what we're really going for at Recovery Friendly Workplace is a culture of support. So this came from GenFoot, which is the business that we have represented today. And one of his employees, his former employees, Sean, who actually went on to start his own recovery residence, which is really cool. And Mark is very supportive of that and has loved seeing Sean grow from not being employed to working at GenFoot to getting his first apartment, getting his first car. Like it's Sean's amazing. It's been really cool to watch his journey. But he said that every time I walk into work, GenFoot, and see that symbol, so the Recovery Friendly Workplace symbol, it gives me a little more hope that people do care. That's kind of what it's all about. So I don't know how much time I'll have to go like way in depth about our survey, but I did just want to highlight the Recovery Friendly Workplace survey that we did. I know that people can be very interested in, data and kind of learning more about outcomes. So we did, I would really call it an exploratory survey. And the purpose of it was to assess the degree to which RFW was being implemented. So kind of fidelity to the model, because in order to assess impact, you need to know, to what degree is your model being implemented. Looking at how RFW activities might be related to desired outcomes, and then getting feedback on what's working and what else businesses are needing. And we had a sample size of 75. Like I said, the response rate was about 25%. And initially we had a much longer survey and we really had to pare it down, but we were really happy with how it turned out. And it only took our employers an average of about 12 minutes to complete. And this was at a time where I think we were still really feeling COVID related impacts and shortages. So we were happy that we were able to get the responses that we did. So this is just our 2-pager, which I can also get out to people. And this is not even the full report. We actually have a full survey report, but this just highlights some of those outcomes. And so in order to kind of get at impact and tying it to RFW, we did that through asking our questions in a specific way. So we asked respondents, as a result of participating in Recovery Friendly Workplace, to what extent have you seen the following change? And people could say like, hasn't changed at all, changed a little. I think we had maybe an unsure option, and then, changed a lot or changed greatly in terms of whether things had increased or decreased. So the first portion of the survey is going into, we just kind of selected some outcomes to highlight. And so, for example, 70% of respondents, which were really our points of contact at workplaces, said that supervisors' confidence in knowing how to respond to employee concerns about substance use had increased. Same thing, a great increase in knowledge of resources available for SUD treatment and recovery. We had 2 related to Narcan. So 41% said employees' knowledge about how to use Narcan had increased. 35% said that accessibility to Narcan in the workplace had increased. I should also mention that's another thing that we do is we can do Narcan trainings and distribute Narcan to workplaces. So that's been cool. A lot of our workplaces has been interested in that. And yeah, like I mentioned, that piece about policy, with almost 40% of people indicating that they had made a change to their policies as a result of participating in Recovery Friendly Workplace. And then we had some really cool qualitative data around, for example, one of our questions highlighted here is, what are the most meaningful ways that your workplace has changed since becoming a recovery friendly workplace? And I love that just kind of big, simple one in the middle, that employees know we care. So a little bit more about some of our best practices and the national support that we offer. So I think that having that streamlined process and that 1-page checklist has been really helpful. Having the governor's support to launch this and kind of have a statewide platform is very helpful in terms of scalability. I think that sometimes other states can struggle when they don't have that kind of launching point, because it becomes, how do we get this up and running? Which is why I'm really glad that we have Tyler here, because he can speak to that a little bit more in Ohio, how they've done that countywide pilot. We did start with the formation of an advisory, or like I said, we have an advisory council, and that's kind of cool because it's like having a built-in focus group. When we started, we were meeting monthly, and then now we meet quarterly, and they are really a tremendous resource. I think having strong branding and assets and messaging, having physical materials that you can give to businesses or have when you're out trying to do recruitment and outreach has been really important. Prioritizing the business experience, customizing the approach, embracing the continuum. Again, it really all comes down to relationship building. And like I said, that our businesses get to work one-on-one with their recovery-friendly advisor has really been everything. Leveraging local partnerships, they're really the experts in their communities. Our team has a statewide focus, so we can't know everything that's going on everywhere in the state. So really, I'm leaning into our partners as the local experts. Finding champions to encourage peer-to-peer learning, building out training content, evolving to stay relevant. We're always kind of, have one ear to the ground and are trying to see what our businesses need and then kind of meet those needs. And then not being overly prescriptive and letting the business shine. Like I said, letting yourself be surprised. So in terms of national efforts, so we run a multi-state community of practice in which we bring together the different states that are interested in doing recovery-friendly workplace in their state. So this map shows the representation. There's actually going to be an updated map because there's even more fuchsia than what's on that map. But this shows the representation at the RFW community of practice from different states. And then on our website, you can actually download this map. Tyler, by the way, I did just update Ohio's link, so I do need to change that out in the Google folder so that people can click on your initiative, but I just did that this week. So you can click on those little numbers and it will take you to kind of whatever RFW related work the state has. So sometimes it might focus more on workforce development. Sometimes it might be a toolkit. Sometimes it might be a full-fledged RFW initiative, like is the case in Ohio or Rhode Island or Nevada. So the goals for our community of practice are really to bring people together to foster collaboration and synergy, allow people to exchange best practices and share resources, identify barriers and crowdsource solutions, and really connect with other peers in this space. We've held 6 COPs. We have about 250 people on our distro list. If you're interested in joining, you can email me. I think my email is in the chat, but my email is sam@recoveryfriendlyworkplace.com. And this just shows the growth of that community of practice since November of 2021. We started with that amount of states, and then now we're taking over the country, but in a good way. And then here are some of the topics, or here's the topics that we've covered at the 6 communities of practice, just if you wanted to get a sense of like, what are we talking about? This is part of the way in which we try to support other states and provide some technical assistance. We're not funded necessarily specifically to do the national work, but we really do our best. And the community of practice was a way for us to kind of scale the efforts, but beyond that, make it so that people can connect with other people beyond New Hampshire who are doing such great work. And so we do a lot of flash talks. We've done breakout rooms. Our last COP, if anyone was on the call, I'm sorry, we kind of ran out of time to ask as many questions as I would have liked, but it was very dense, such great information. And so if you're somebody who's interested in implementation in your state, or if you have something up and running and you would like to join, please definitely shoot me an email and we can get you on our distro list. So again, there's my contact information. Our website is recoveryfriendlyworkplace.com. Here are all of our social handles. We have Twitter. We're pretty active on Facebook and LinkedIn. We also have a YouTube channel. So we would love for you to follow along and connect with you that way. And I'm finishing right on time, which I'm very proud of because there was a lot to get through. So I'm going to stop sharing so that Tyler can take it away.
Hey, Sam, I just wanted to jump in, and there were a couple questions I think that would be helpful to answer before Tyler goes. Someone
Okay.
asked, what does MLADC mean?
What's that?
What does
an MLADC. So yep. So a LADAC is a licensed alcohol and drug counselor. And so an MLADC is somebody who has a master's in that field.
Perfect. And then the other is, in this continuum, who is representative of having lived experience? is it always the resource coordinator?
In which continuum?
So I believe it was the slide where you it addressed the organizational structure. And you were talking about, I think, both people with lived experience being like colleagues or coworkers, and then that some organizations have a resource coordinator.
Oh, yes. So I would say what we found is in workplaces when they kind of utilize, so Mark actually would be great to speak to this because they formed a helping hands committee. But what we found is, I think a lot of times when employers go that route, a lot of times people who do have lived experience and who have been impacted do step up and are interested in giving back. And they'll be like, hey, I'm in recovery. Like, I would like to get trained on this and be like a recovery resource champion. Sometimes it's people who've been indirectly impacted. As we know, I feel like very few people have not been impacted in some way, but it could be someone who's interested there. It's like the employers kind of let people voluntarily come forward and self-select. From what I've seen, for the most part, they'll say, you know, who's interested in doing this.
Perfect. Thank you so much, Sam. You're always just such a wealth of information, and I love what you all are doing. And I'm sure there'll be lots of questions towards the end of today's presentation. We are going to move on and hear from Tyler and the efforts in Hamilton County, Ohio. And just so folks know, we have a representative from Illinois here, as well as 2 featured employers. So we're going to keep things moving. We'll respond as we can in the chat, and then we will have some time at the end for people to unmute and ask questions. So Tyler, feel free to take it away.
Okay, very good. Let me make sure that I've got my slides up and running here. One moment, everyone. In spite of being millennial, I am not that sophisticated when it comes to technology. And I'm operating on 2 screens, and that's making everything that much more difficult. One second here.
Tyler, in the bottom right-hand corner, there should be like that slideshow.
Yeah, the unfortunate thing is, give me 1 second, sorry. I'm operating on a second screen that's connected to my laptop that does not have a very large surface base, and it wasn't displaying that. So I've got it now, and we should be good. Everybody there?
Perfect, looks great.
Okay, terrific, right? Just a little bit of technical difficulty. So I want to start off by thanking Samantha for her great presentation and just indicating that she was being somewhat modest when commenting on the amount of support that the state of New Hampshire and their RFW initiative is offering to any agency that is willing to replicate that model. She has been a phenomenal font of resources for me thus far and has really guided me on this path of adopting this initiative at a much smaller scale. And it continues to this day to provide me with a lot of great resources. So Samantha, don't underestimate the impact that you have on those of us who aren't as far along as you are with the initiative. So again, thank you. What I'm really illustrating is the scalability of the recovery-friendly workplace model, because unlike the state of New Hampshire, we are not a statewide endeavor. Recovery-friendly Hamilton County is just that. We are a county-wide initiative specifically for Hamilton County, which is Cincinnati, Ohio, in southwestern Ohio. I work for Hamilton County Public Health, so our local health department. I am in the harm reduction division, so my colleagues primarily work on Narcan distribution, fentanyl test strip distribution, overdose fatality reviews, and my position is somewhat distinct in that I'm the only party who's really focusing on the workforce. And when I first came on board, there was some confusion as to what my role would effectively be. So with some good kind of quick research, I was able to find this terrific model that existed in the state of New Hampshire, and to be able to convey that to the powers that be at my organization and replicate it. And we've had a lot of great success early on. But mind you, we just launched in June of this past year, so we are very much a fledgling program. So the data is incipient. You're not going to hear some of those same great outcome measures that you heard from Samantha, albeit we have won an award thus far. We have given out a survey, and those are very favorable. I just don't have anything quite that significant to showcase to you. I hope to be able to do that a few years from now. So the idea behind my job is effectively I am a liaison between the world of business that exists within Hamilton County, which is quite rich, and the world of treatment that exists within Hamilton County, which is also quite rich. They say that necessity is the mother of invention, and unfortunately, as many of you know, the state of Ohio has been hit quite tremendously by the opioid epidemic, Cincinnati in particular. So we do have a lot of phenomenal resources that exist and have sprung up in the wake of that crisis. So it's a way for me to bridge the gap between these businesses, which we know are struggling, and the treatment agencies that we have in this county, which are all terrific. I don't know if Sam mentioned this, but there are a lot of statistics that we use to try to bolster our pitch with organizations. And one that I often rely on is that 70% of people who have a substance use disorder are a part of the workforce. We tend to have this very cliched notion about people who are strung out on the streets, not working. That's really not the case. Most people who have a substance use disorder are in the workplace. So inevitably, no matter your company's size and scale, you're going to be working with people who suffer from substance use disorder. But more than that, you're going to be working with people who have overcome and are in recovery. And this initiative, just like the state of New Hampshire, is just as much about trying to assist people who are struggling as it is about honoring those who have overcome that and are identifying in recovery. So I won't bore you with kind of the philosophical underpinnings. Samantha really did a good job of highlighting how this whole thing came to be. The text over here on the left-hand side is, directly taken from the New Hampshire initiative, and it's all about encouraging that healthy and safe environment where employers, employees, and communities can collaborate to create a positive change. As Samantha indicated, we are based directly on their model. We do have some slight deviations that I think are very appropriate for us in so much as we're a county-wide endeavor and not a statewide endeavor. But everyone that is a part of this larger family of recovery-friendly, of the recovery-friendly paradigm, if you will, it's terrific. It's great to be a part of this community. It's great to get assets from other people, the business leaders that are a part of it, the other statewide endeavors, the other county endeavors. I certainly would not have been able to take this as far as I have without their assistance. And it's great to know that we can rely on this network to be able to share assets and share information and go back to our direct constituents and provide them with information that we may not have had otherwise. So how we got started at the health department, we are actually funded by the CDC in my division. We are on the Overdose Data to Action grant. We're applying for it again, and we have a lot of other tremendous sources of funding. So I don't anticipate this initiative going away anytime soon. But it's just a distinction that we have from other RFWs across the country from what I found. My supervisors had a vision for impacting workplaces. I did a lot of very quick cross-country networking, and lo and behold, this whole thing came together pretty quickly because the model was very solid in New Hampshire and in other places where I was able to get that kind of core template and replicate it as best as I could for a county. So Samantha talked about the offerings or how they support the workplaces in the state of New Hampshire. So I'm going to take a minute to illustrate some of the things that we're able to do, how you might be able to replicate this if you're looking to go down this path as well, some of the things that make us a little bit distinct from their statewide effort, and some of the things that work really in harmony. We do the linkage to care. So with linkage to care, what that means is I actually am requiring my businesses to put posters on their physical premises that display local treatment providers and 24/7 hotlines, as well as my phone number, and a QR code that will link them to free fentanyl test strips, free Narcan, and then everything else listed on that poster pertaining to local resources. So that's one avenue that employees are able to use to be able to find those resources anonymously. But more than that, I make myself available as a direct consultant for HR so that they can communicate with me to be able to make that warm handoff. So you might say, I'm just one person, that could get kind of overwhelming. We're not a statewide initiative. Samantha indicated that she's got 4 people who are working directly with her, who are not necessarily doing this warm handoff work. That is why it's so important for you to network and really rely on, the vast array of treatment providers that are really, really proficient in your neck of the woods or in your state. To be able to help with this endeavor, forming memorandums of understanding, contracts with them, perhaps looking into funding sources that you can provide for them, because it really takes a village to pull this off effectively, I believe. We do the formal designation, just like New Hampshire. We have our own logo. If you look down there in the corner, it is a check mark with a road built into it that symbolizes our endorsement via the check mark, and it symbolizes the road of recovery via the road. So it's something I'm very proud of, and we do the same vinyl decal clings and what have you. A lot of what we're offering, again, I'm not going to get too much into the weeds about because Samantha covered some of the same ground that we're doing here. As the health department, we're very rich in harm reduction resources. So we do offer the Narcan, the training, the fentanyl test strips, this training if employees are looking to get that. One really neat avenue that we've just started to pursue, and I'm hopeful that I can kind of break out of this and share my screen. We are doing a recruitment piece. So for those among my constituents who are really looking to, as the phrase goes, put their money where their mouth is, and recruit directly from a community of people who identifies as being in recovery, we have a job board functionality. So I'm going to see if I can get out of here. And if one of my presenter colleagues could just confirm, are you able to see the content that I'm displaying here?
No,
No,
we
we-
still see your slides.
Okay. I've got to do the stop share, the new share. I love this technology. There we go. Okay, great. So we collaborate. We actually have a contract with our local Chamber of Commerce, and they have a leg that is primarily focused on the DE&I space called the Workforce Innovation Center. But they're great consultants, and what they've done for us is they have actually developed a job board whereon my designees can signify their recovery-friendly status as a job perk, and then also include a direct link to available positions that they have. So then what I'm doing on my end is communicating this existence, the job board's existence with the recovery community of Hamilton County via recovery housing managers, local treatment facilities and the like. So again, just a really neat approach to be able to allow employers to not only say, hey, we're recovery friendly, we offer these resources to our existing employees, but to also be able to reach a new base of untapped potential and untapped talent. Because if you don't know, people in recovery really make phenomenal employees. And there is a lot of data out there to support what I'm saying. They absorb less healthcare costs. They miss fewer sick days of work each year. Just a lot of great statistics that favor people in recovery, even over the general workforce. Get back to sharing this. And again, if you could confirm, am I in the right space here? Can everybody see my PowerPoint?
Yes.
Okay, great. One other quick thing I'll touch on is that I am working right now via some new grant money with a labor law attorney and an HR consultant, and they are scouring the universe right now of all the progressive substance misuse policy in the workplace that exists. And they're putting together a comprehensive compendium that I'm going to be able to share with all of my designees if they're looking to make those kinds of policy adjustments. And what they're finding in this process, and Samantha, I'm sure could chime in here or later on in the discussion, is that this is really novel work. This really hasn't been done before. There are a lot of people in key leadership roles across the country right now who are trying to set some gold standards for best practice in the workplace when it comes to substance misuse disorder and recovery. And how do you do a good second chance agreement? How do you do a return to work agreement? How do you handle drug testing? So again, I'm hoping that what we can generate leaves a good front, at least on the local level. And then hopefully there are some bigger discussions and think tanks with much smarter people than myself who can help spread this stuff across the country. So our requirements are very similar to Samantha's. The only primary distinction is that we do make them put those posters on their premises to display local providers. I can only imagine that for the state of New Hampshire, that would be a large headache because you're trying to coordinate all across the state, whereas I'm coordinating within one very specific region. So that is something that we do. When you're making the pitch to businesses about the humanitarian and economic angles, what I recommend and what I have the benefit of here is an epidemiology team within my health department who can kind of calculate some of the data for you surrounding overdose deaths and occupations. So there's one quick little thing I'd like to show with this last little minute I have here. And again, I'll have to do the new share. This is from Hamilton County. These are all of our overdose deaths within the past 5 years, so from 2018 to 2022. And we have them divided out according to the occupation that was reported at the time of death. So if you look at this, there are a couple of target industries that we really need to make some headway into if we're going to make this work truly humanitarian and impactful. And those are primarily construction, production, and then food serving, which I think is something that a lot of us are probably already aware of. But again, if you're looking to fine-tune your pitch and really get employers to take notice of this, work with your local health department, have them pull some of these numbers for you. It's quite startling. It's very stark. It's frankly kind of depressing, but I think it really impresses upon people the notion that this is very important work. And then quickly share the PowerPoint one more time, and then I think we're almost good for me to wrap it up. So even though we just launched in June of this past year, I'm very proud to report that we've already recruited over 28 businesses in my region, some of whom are rather large. I don't expect anybody on this call to recognize some of these names unless you are a Cincinnatian, but if you are a Cincinnatian, some of these are really standouts. So it's gone terrific. Our local politicians have supported it. We've had press conferences and the like. So things are going quite well. We just recently got the results of our first survey back, all of which were very favorable. And our local workforce council just gave our division an award for the great work that we're doing. So things are going well. And I think it's just a great model that New Hampshire created. And we're happy to be a part of this bigger family of recovery-friendly workplaces. I do want to say, I think one of my friends and kind of family members in this whole initiative is on the call, Allison Steele from JVM Packaging. You can see them up here. They are a phenomenal second chance employer based in Hamilton County and the surrounding regions. And Allison is terrific at what she does. So I'm happy that she was able to join us today to be able to respond to things on the more kind of employer perspective. So I will close out. And again, thank you so much for your time. Hopefully my technical difficulties weren't too big of an impediment. I apologize for that.
Thank you, Tyler. And no, the technical difficulties were barely noticed. Before we move on to Stephanie England in Illinois, I just had 2 questions come up in the chat. Someone was asking about if you are familiar with or know offhand the resource that you used for the 70% statistics for those in the workforce.
Yeah, I think that was SAMHSA and Samantha Lewandowski. You might be able to correct me if I'm wrong on that. I don't have my second screen up right now. It's actually on my website, and there's a direct link back to the source where I'm getting that information. Samantha, am I right on that? Is it SAMHSA? You're on mute.
Oh, I was just saying that I don't know the 70% one off the top of my head.
Well, we
But
can look.
you're familiar with that though, correct?
I think I've heard it before, yes.
Okay, let me see if I
Yeah.
can pull that up.
Yeah, and so
I
feel
don't
free
think making it up, if that makes you feel better.
to.
Yeah, it is, okay, it is from the National Safety Council.
Perfect. And
Yes.
then thank you, Tyler. And then also, someone asked, they may have missed it, but what's the difference between a designee and an ambassador designee?
Oh, that's totally arbitrary. The first 15 people that joined us, we just thought it was, so at the time that our first 15 joined us, our county, so the seat of our county government actually decided to render the county as an employer recovery friendly, and they were having a press conference for us. So we said, hey, these are all of our early adopters. I think that's what Sam calls hers. Let's give them some special recognition and call them our ambassador group. It doesn't entail any other, advantages compared to our other designees. We just give them that kind of social currency or attaboy to say, hey, these were the people who took us on when we were very new.
Awesome. Well, thanks again, Tyler. Super cool to hear about what's going on in Hamilton County, and such a great example of how quickly these efforts can take off when you get started. Next, we're going to move to Stephanie England. She is here representing efforts in Illinois. And Stephanie, as soon as you come on screen, I believe I'll be able to spotlight you so you can join Tyler and Samantha on the screen.
Hi there.
And you're there. All right. So just give me a moment and I'll spotlight you so you're up. I know we didn't ask you to bring any slides, and Tyler and Sam, I'm going to keep you on screen. So at the end of Stephanie's session, as questions come in, we'll pause again before moving on to Mark and Allison. But go ahead, Stephanie, take it away.
Awesome. Thank you, Chris. Thank you, Sam. Sam Lewandowski from New Hampshire has provided so much insight, support, technical assistance. She's been my right hand person since the beginning. So just a little bit of a background on the Recovery Friendly Workplace Initiative in Illinois. So I am, my background is as a substance use counselor. I'm a licensed social worker. So I have worked in direct client care for close to 15 years. I'm also a person in long-term recovery. So in the process of working on problem-solving courts as a treatment provider, managing recovery homes, I have so many clients who are having barriers to employment when they were working their recovery program. And so because of that, we developed what we call the Business Roundtable, and we brought together in July of 2019, the Dixon, Illinois Township Supervisor called me to ask me how to get people who might have criminal history, criminal involvement. How do we help them get jobs? And I said, Ed, that's a problem I have as well with my clients. So we met and we decided to solve this problem, and we started to invite a handful of stakeholders within our community, within Lee County, Ogle County, and Whiteside County. So this is a Northern Illinois area. And the momentum grew. The agency representative from Lee, Ogle, and Whiteside County was transportation. We strategically invited people, organizations, and coalitions who were working in this space in transportation, medical and behavioral health experts, employment agencies who are usually the go-between between the employer and the employee and the job seeker. And there were so many barriers that were happening in employment agencies that we found that the employer had more flexibility of hiring people that might have a history that would inhibit them from being employed, from being hired based on what the employment agency was seeing. And so we went directly to the employers and they said, okay, we can work with some flexibility with this population. now that we know. Other individuals at the table were Illinois Department of Employment Securities, probation, problem-solving court officers. So we sort of had the gambit. And concurrently, the Business Roundtable worked to remove the barriers to employment for disproportionately impacted individuals. We had a multi-county consortium that was conducting a needs assessment for Health and Human Service Administration grant, a HRSA grant, which was under the Project Open Opioid Prevention Engagement Network. And so when that grant, when that project got awarded $1 million HRSA grant, one aspect of that project was to develop a workforce champion group. And so we, as the Business Roundtable, became the HRSA workforce champion group for Project Open. And from there, we surveyed respondents, we surveyed employers, we received really interesting information back regarding what some of the concerns were from employers, and how flexible they are in their ability to hire individuals that might have, criminal history in addition to being in recovery. Because what we found was a lot of individuals who are in recovery, they also have some form of law engagement history, right? And so it might not be, a big red flag, but it is a barrier to employment. So we triaged individuals in recovery for employment readiness. At that point, the Business Roundtable's goal was to remove barriers to employment, train skilled job seekers with network employers. So we really wanted to make sure that the job seekers and the employers were teamed up. And the Recovery Friendly Workplace Initiative was adopted in 2021 when, I met Sam and I found out about New Hampshire's wonderful program and curriculum, and she gave me access to all the trainings, and I sat through all the trainings. I did it on my own. It was amazing. It was like 8 hours. And we ended up, our consortium developed, took that model. We pretty much adapted it. We took my experience in substance use and counseling and used that training format, sort of developed our own training. Same structure. And most recently, we've been working with, the 102nd General Assembly. I'm just going to speed up right now because that was a little bit of our past and where are we at right now. So Illinois has 102 counties. There are 10 recovery community organizations within Illinois. Now, let me just rephrase that, 102 counties. So obviously the need for representation throughout the state and support is really big. And this initiative started in Lee County where I'm at, but the goal is to work within all the counties in Illinois. So we have strategically have agreements with the RCOs throughout Illinois and the Ross councils to train on this initiative and work with it in their local areas. So the 102nd General Assembly in Illinois passed legislation for recovery mental health tax credit. This is really important momentum. I was working with the co-authors of the bill. And right now, the legislation has been signed January 1 of 2023. It hasn't been implemented yet because right now it went to the Illinois Department of Human Services. And so I've been working with them in meetings on how to best translate the legislation into actual policy. What you find, and this is sort of a tip maybe to other states who might be in the process of trying to do legislation. So Illinois is grassroots, as I discussed earlier. We started with a small coalition in our community because we saw a problem and we wanted to solve it. We adopted the national model from New Hampshire, which is very powerful and it hits all the marks. However, what we didn't have was sort of the top-down approach, from the governor's office, right? We have the mental health and behavioral health committees in our legislature are working on this, and they were able to, you know, see the problem and say, we need to deal with this. It was part of an omnibus bill that was passed. And the policy basically says in the legislation that employers need to provide a recovery safe environment. That's pretty much it. There's some other criteria. And so now it goes to Illinois Department of Human Services, and how do we, you know, operationalize this legislation? So the behind the scenes, we've been having these discussions of what that really looks like, taking lessons learned from our national COP, you know, learning from other states, and what's really going to work moving forward. Right now, we have Recovery Friendly Workplace has completed. Just give me 1 second here. I'm going to go through some of our achievements for you. So we have completed 25 surveys from pre and post trainings conducted in the workplace. So the surveys are used to identify trends and learning from the training that we provide. It's really important for me. I love research, just like Samantha. Her data is amazing. I love your data. The data is great. And so before I go into an employer to do the training, I send them a pre-training survey. So what it allows me to do is kind of gauge their level of understanding of the topics that I will be training on in that session. And immediately after the training, I send them a link to the post-training surveys. This is all electronic. And usually we get about 100% respondents, which is great. So we've done these pre and post training surveys. We can see that the learning outcomes are having a positive impact. My background additionally is I'm a trained DUI service provider in Illinois. And so when you are facilitator for the risk education courses for individuals who have had a DUI, their first DUI, but they have had an assessment where there is no symptoms to diagnose that there is a substance use disorder, they still have to do a 10-hour risk education class. And I facilitated so many of these training classes that I can do it in my sleep. And so one thing that I found, which was like one of these fun things that you just don't know you're gonna receive, is in the trainings. I naturally have the language that talks about moderation, right? So we're not just addressing people in recovery, but there's also information on moderation, understanding alcohol moderation. And in one training, it was with all the sales managers of our area big car dealership. Ken Nelson, they're an RFW organization, and alcohol, we know alcohol is, pretty widely used in high risk, stressful, industries. And in one of the conversations I was having in that training, I don't know how I ended up here. Maybe somebody asked me a question, but I basically said, 5 to 7 alcohol a week, no more than 2 a day is moderation. And the looks on people's faces was just staggering. They were really surprised. And later I went back a few weeks later to follow up with the liaison at Ken Nelson Auto Group. And I said, so how's it going? What are the conversations like? And she said, people are really talking about reducing their alcohol use, and they're having conversations about being really aware of consumption. And that was a really inspiring, exciting thing to learn, that not only does this RFW initiative work with help to reduce the stigma about substance use disorder, but it also has a really positive impact on the prevention space. The prevention space, I see David clapping his hands over there. Sorry, that was distraction. Somebody's happy. So the prevention part of it is in a very tangible, important aspect that we in Illinois are incorporating into our trainings. And I think, there's an area here that we can really explore as well, because we know that if people are aware of their alcohol consumption and they understand what a drink is, 1.5 ounces, the consumption rate of how it's absorbed in your body, the rate of how it's metabolized afterwards. That information should be widely known and understood, that you can have, one beer and it gets absorbed in your body within an hour, but it leaves a lot slower, right? So we completed the employer surveys. We have developed a memorandum of understanding and a roadmap for employers to provide what we called second chance employment, and we're changing that language to network employer. I really don't like the term second chance, even though it's out there. We've developed all the training curriculum for employers. We've been doing the curriculum and the training either in person or by Zoom. And then on the broader spectrum of helping to get this initiative into people's minds, right? So we're doing a lot of, it's almost like business to business marketing, but we're doing it through Society of Human Resources, the SHRM groups, the Chamber of Commerce's, the Rotary groups, and those smaller organizations that have large memberships have been sort of my point of focus. I recently just met with the EAP organization, National EAP organization, and learned a little bit about their strategy. So another aspect that we are going to be adding to the recovery friendly workplace is to really have discussions with the actual EAP that the employer is using, so that we can be on the same page with the EAP, because what happens is it looks like it could be another EAP style offering that comes through when it really is just sort of an add-on. So and we really need to understand, and this is my lesson learned, and I'm going to share this with you, is when we go and speak to employers that if we can ask who their EAP is and set up a meeting with the EAP so that we can be on the same page with them. And that partnership is really important, because the recovery friendly workplace is really this initiative that helps to reduce the stigma, bring knowledge and understanding and information to the employers to support the employees. But it's also an opportunity to engage employers as, like I said, second chance employers, and really open up this field for individuals who are job seekers and linking them to employers who want to hire those individuals. So at this point, we have the Recovery Friendly Workplace Initiative has moved beyond 3 counties, and we have, like I said, our strategic partnerships with the RCOs throughout the state of Illinois, and working on this. Once IDHS is able to create policy around how to administer the tax credit will be an additional selling point for employers who actually pay taxes. So the Tax Credit Act is really not a selling point for organizations that don't pay taxes. And in areas where there are higher rates of stigma than others, right? And so you might find a community that's more open-minded. They have much more of a embracing around holistic views to address substance use. There are some pockets of communities that have less holistic views on embracing substance use disorder, and we have to push through in a gentle way the stigma in order to actually have meetings with those employers and to bring this understanding, to bring the message to help their employees. And one of the ways to do this is to look at the non-fatal overdose rates. And so for a long time, the access to that data just wasn't there, unless you were talking, like Tyler is at the health department, unless you're having discussions with the emergency room. We now have access to non-fatal overdose rates. And the reason why it's important to me is because that gives me an opportunity to see where these pockets of problems are and help to address this with the employers. So there was an example where there was an employee.
Sorry
Yep.
to interrupt. I just want to make sure we have 2 employers that are set to go yet. And we're just coming up on 15 minutes left in today's session. I love everything
Thank you.
you're sharing with us.
Just to let you know is that I can ramble on, and so I really appreciate, Chris, you giving me my 2-minute warning. I just want you to know that I'm available to contact me, to reach out, to ask any questions. There's a lot of things happening in Illinois. This initiative is really strong, moving. I want to say moving fast, but it moves slow, and then all of a sudden it moves really fast. And for those of you thinking about adopting this initiative, it really is the most amazing thing, very rewarding, and we're all here to help you along your journey. Thank you.
Thank you so much, Stephanie. Another great example of a different state approach to creating recovery-friendly workplace efforts. Next, I'm gonna, as soon as Allison and Mark come on screen, I will spotlight you, and then we will have our 5 presenters. Allison and Mark can introduce themselves, but they represent our partners that help make this possible. So welcome, Allison. Feel free to unmute and start, and then
Okay.
Mark will go right after you. Thanks so much for being here.
Absolutely. Thank you for inviting us. I'm from JBM Packaging. We're a manufacturing plant in the greater Cincinnati area. We have 2 locations. We've been working with Tyler for, gosh, I don't even know how long now, Tyler, 9 months or so. We're a Fair Chance hire employer, we call it. Second Chance, we call it Fair Chance. We've been in the Fair Chance space for about 5 years. I am the Better Lives coach and learning development specialist, and we just brought on another Better Lives coach. So we do a lot of in-house coaching and support for the men and women that we hire. About 30% of our population are all Fair Chance. This Saturday, we're having a Better Lives graduation that we celebrate a whole new round of men and women that have made significant change. So recovery friendly, obviously, people coming out of incarceration, a lot of the crimes that we hire are around substance abuse. So I won't get into too much because we don't have time, but I am willing to share whatever we do, how we do it. We've learned a lot. We have agreements and substance abuse, not substance abuse, substance misuse agreements for people that use, and we want it, they're great employees. That's a part of their journey, and other things. So I'm willing to help. I'll hand it over to Mark.
Thanks so much, Allison, and welcome, Mark. And I apologize that this is just such a great topic that we could talk for hours, but go ahead and jump in and tell us about what you're doing.
Yeah, I feel the same. I could talk for hours about this topic as well. I'm pretty passionate about it. My name is Mark Bonta. I'm the plant director for a company called Genfoot America, LLC in New Hampshire. We manufacture Kamek outdoor footwear. If you have kids, you're probably familiar with the brand because we're the #1 kids winter boot brand out there. We've been in Littleton, New Hampshire since 1992. And we became a state designated recovery friendly workplace in 2018. And I also joined in the same year, I joined the State Advisory Council for the initiative. And it's been about 5 years now, and the initiative has grown immensely compared to how it started. Sam is a very, very busy person now, but her and her team do a fantastic job. I'll try to make this quick. This can be a long story depending on how I say it, but in 2018, when I first heard about it, it immediately brought to mind an employee that I had fired back in 2011 for coming to work under the influence of alcohol. Tragically, within 6 months of losing her job, she had passed away from liver failure because she couldn't stop drinking. That's why I'm passionate about this, because, you know, with the advent of the theology and the thinking revolving around recovery-friendly workplace initiative policies and things like that, it's very possible that she could still be alive today if I'd have been thinking that way. At the time, I didn't think I had any other choice. So I'm heavily involved in the initiative, and get out with the support of my employer, which is fantastic. I'm able to get out from behind my desk and work in the community in many different areas, but I think my primary passion is for the recovery-friendly space.
Thank you, Mark. That's I really appreciate you being vulnerable and sharing that story, and that you took the lead on changing the culture in your workplace so we can help people if we recognize that they're struggling with substance use issues. So thank you so much. This is our time to kind of open it up. I had some questions I sent out to the presenters ahead of time, but I definitely want to poll the audience. So feel free to type something into the chat if something piqued your interest or there's something you want to know more about. And in the meantime, I think I really want to hear from Allison and Mark as far as I think we address maybe some of the misconceptions that we have around people with substance use issues and how an employer can play a part in accessing recovery. Anything else you want to share, Allison or Mark, on that front?
Sure. I'm glad you brought that up about the perspective of how we view people in SUD. I actually spoke about this yesterday at a meeting in regards to recovery homes in the state of New Hampshire and the need for more of them. Sean Canizaro was there. Canizaro was there. He was an employee that first was one of our first hires from the recovery homes here in Littleton, and not only did he do very well, very quickly with Genfoot and in the recovery homes, he has actually opened up his own recovery home now, and he is a fierce advocate for the recovery-friendly space and recovery homes. And you know, when I was 12 years old, I started smoking cigarettes. And I've been a nicotine addict since then. As a matter of fact, I still have a nicotine patch on today. That's how hard it is. I have not been able to beat my own addiction. Sean Canizaro, in my opinion, he has more strength of character than I do. He's beat addiction. He's got one of the most difficult things to do on his resume. This is something that I think a lot of professionals that have these fantastic resumes of all their accomplishments in their work that aren't able to put on the resume that they beat addiction, and that includes me. So I've got a lot of respect for anybody that can get through that sort of thing. And that's something that I think isn't talked about enough.
Thank you, Mark. That's a truly inspiring message. And as a person with lived experience, I greatly appreciate it. Allison.
Yeah, I was just going to add, I think we try and look at it that we're all human, we're all in recovery from something. We all have addictive behaviors. If it's not substances, it's relationships or feelings or coping mechanisms. And so I feel like we connect on a human level, which really helps. But the other thing is a lot of people don't get sober because they don't have the right support system. So it's so very important as an employer that we become that healthy support or a part of their healthy support, and we help them build more healthy support. It takes one healthy adult to build somebody's resilience and their ability to bounce back by like 80%. We are big on felt safety, being a trauma responsive environment, and providing healthy relationships in the plant so that people feel supported and cared for and seen and heard and valued. And now people in recovery that we have hired, we've got one as a second shift supervisor. He's incredible. His lead is one of our graduates. She's in long-term recovery. She's incredible. Our main recruiter for our entry-level roles, she's in recovery. I recruited her out of one of the prisons here in Ohio, and she's incredible. And so we've got people in leadership positions that have started on the floor and have been just promoted up that support our workforce. And that makes all the difference too, because they've been there. So that's what I would say.
Thank you, Allison. One last question for Mark and Allison, and then I have the ultimate funding question around for Tyler, Samantha, and Stephanie. So Allison and Mark, someone asked if there's how did the colleagues react when you do have a person who's in recovery or who's struggling and then goes and gets help and returns to work? How do the colleagues in your organizations respond or react to that or relate to the person?
It's okay if I go first, Allison? Yeah, thanks. Excuse me. Well, first of all, the one thing I do want to say is that, protecting your workforce is very important from, any negative things that might be going on. So if you do have somebody, that is actively using in your workforce, you do need to temporarily remove him or her from the rest of the workforce to protect them. The other angle of it is about stigma. If you make this declaration to your workforce that you're going to take up this initiative and you're going to work, let's say you're going to hire directly from recovery homes, things like that. You need to make the distinction very, very clear that there's a difference between an active drug user and someone in recovery. And one thing I always say is drugs are bad, recovery is good. We need to remind people of that because some people get the misconception that because you're recovery friendly means you're going to hire a bunch of addicts. And that's not the case. You're hiring people that are in recovery from it. And if someone, like in the question that was posted in the chat box there, if someone does have a setback that has been doing well but has a setback, that is to be expected. Having setbacks like that is a part of recovery. So you want to go back to step one. You need to remove that person temporarily from the workforce to protect the rest of your workforce, and then work with that individual separately. Now they've got a choice. This is how I do it. They've got a choice. I can either terminate them because they used, or we can talk about what requirements that person has to do to get back into work, and that requires a return to work agreement or a substance misuse agreement, like Allison said. We use the same term. And that agreement is, first of all, they need to stop using, and they can't go back to work until they submit a drug screening that is negative for that particular drug or whatever. And just also, I'll just note real quick that we never really test for marijuana because marijuana stays in your system for so long after you use. You can never tell if somebody has used it during work or before work or whatever. So it's about opioids, or it's about a breathalyzer for alcohol, or any type of other illegal drug that they shouldn't be taking. So again, remove them. They can't come back to work until they get a positive screen. They also need to sign off on releases so that moving forward during that agreement time, typically starts with a period of 2 years. I, as their boss, can call those providers and ask them, are they going to their appointments? Are they doing what their counselor's plan is for them to do? To make sure that they're staying within the requirements of that agreement. And I make it very clear to them that their recovery is now a responsibility of their job. In other words, they're not doing their job unless they're going to their appointments and they're doing what the counselor says and that sort of thing. So that's how I would handle it.
Thanks, Mark. We have like 1 minute and I can see you want to say something, Allison, so you jump in.
I was just going to say, I think you got to view it as if somebody relapses, it's because they need more support and accountability in their world. They need to be approached with compassion. And so I think we try and approach all our team members that way. If you approach everybody with compassion and understanding, and in the view of everybody needs more support and accountability sometimes to be successful. There's nothing wrong. There's just, we need to do more to help you. So trying to approach it with that mindset, I think really helps. We also added what we call a Better Lives Agreement, where it helps the team member be a part of them realizing where they might have had weaker areas or less boundaries, or where they need to do something different in their world to be successful. And there's more on that as well. So I'll send out my email. I've got a hard stop. So thank you.
Perfect. Thanks, Allison. Thanks, everyone. I know we don't have time to talk about some of the funding issues, but I do suggest reaching out to Sam and talk about recovery workplace initiatives, starting one in your state, kind of being that backbone structure. And then we will be posting this webinar to the Great Lakes ATTC website, so you can come back and refresh any information that you heard earlier. But a huge thank you to Mark, Allison, Sam, Tyler, Stephanie for sharing your knowledge and expertise today. We are eternally grateful for your time.
Thank you all for joining us. I did put a few reminders in the chat for you. Please make sure you visit our Great Lakes ATTC website, as I will be posting the recording on our website within the next week, and then certificates of attendance will be sent out to all who attended the full session. And it may take up to 2 weeks. So thank you all for joining us, and I hope you all have a great rest of your week and weekend.
Thanks,
Thank you
everyone.
all.
Thank you.
Thanks, everybody.